Hello, everyone. My name is Zheng, and I am a PhD candidate at Carnegie Mellon University. I now work at Google as a user experience researcher. Today, I am excited to share our work titled Learning to Become a Volunteer Counselor, Lesson from a Peer-to-Peer Mental Health Community. In one sentence, this study uses interviews with 20 senior online volunteer counselors to examine how they addressed challenges and acquire skills when volunteering in a large mental health support community. This work is done together with my advisors, Haiyi, and Bob Kraut. When one encounters mental health problems, one would often think of going for professional therapies, but research showed that peers can also provide quite powerful support. For example, in this work, we study 7 Cups of Tea, which is a place that connects people with mental health issues with volunteer counselors. 7 Cups of Tea has supported nearly 40 million clients since 2013 and has attracted 320,000 volunteer counselors. This is the main interface for the volunteer counselors at 7 Cups. As we can see from the left side of the screenshot, there is a one-on-one chat window. Volunteer counselors are able to communicate with help seekers via text-based chats. We know that peers can provide strong social support, whether it's informational or emotional, but realistically, the peer's expertise might be limited. Think about a professional counselor who needs to complete multiple years of training along with degree and license required. Peer counselors, on the other hand, could only rely on their own life experience and additional training provided via the platform. For online peer support platforms like 7 Cups, they typically require very brief training before volunteer counselors become eligible. For example, at 7 Cups, volunteer counselors only need to take around 45 minutes of training about active listening, and afterwards, they can start to chat with help seekers. This leads to the research question of this study, which is how do members of online peer support groups develop expertise given they have limited skill sets from the beginning? So in this case, we first need to define what is peer expertise. So our definition of peer expertise for volunteer counselors are framed from 2 perspectives. First, it is the ability for volunteer counselors to deliver counseling sessions of high quality or to better help others. Thus, the first sub-research question is, how do online volunteer counselors acquire therapeutic skills or to deliver high-quality counseling sessions? The second aspect of peer expertise for volunteer counselors is how the volunteers could better protect themselves from the negative consequences they might suffer when providing support. Therefore, our second research question is, how do online volunteer counselors learn to cope with the stress of counseling to protect their own psychological well-being? For this work, we used semi-structured interviews to tackle our research questions. We interviewed 20 experienced volunteer counselors at 7 Cups to learn about their journey from a novice counselor to an experienced one. In the interview protocol, we employed a critical incident approach, which encouraged the interviewees to think about counseling strategies they learned in their experiences and the specific incidents that helped them acquire these strategies. So for the transcript of the interview, we used qualitative categorization and semantic analysis to process our data. Now I am going to present the result of this study. Interviewees described they encountered a lot of unexpected challenges when they kick off their peer counseling career at 7 Cups. For example, sometimes the conversation with the help seekers are not moving forward, and they were worried and be like, did I say something wrong? As the peer counselors might not have enough expertise to deal with this type of tricky situations. And they also have very little ideas about how to protect themselves. For example, when peer counselors were verbally abused by the help seekers, they expressed dismay as well as confusion, as they are not sure how to cope with that. When they encounter these challenges, peer counselors had to develop corresponding strategies on the fly during the conversation themselves. While other volunteer counselors could help from time to time, but external support might not always be available. Despite the unexpected challenges and being forced to think about solutions on the fly, interviewees reported that as they accumulate more experience at 7 Cups, along with some trial and error process, they usually come up with successful strategies. So for example, participant number 8 mentioned that he figured out the first question people ask might not be the question that they really come for. For these strategies, participants claimed that they were able to verify them based on their consulting experience at 7 Cups. But the issue is that such validation could actually be wrong. Take the suicidal cases at 7 Cups as an example. When a help seeker came to 7 Cups and claimed that he or she wanted to commit suicide, 7 Cups has a clear rule that requires peer counselors to immediately stop talking with the help seeker and redirect them to other sources such as suicide prevention hotline. Our findings suggest that, however, volunteer counselors have their own thoughts on these cases and have developed their own strategies. While there are people who are okay with the rule, other interviewees reported they either chose to tweak or even break the rule. So for example, one interviewee mentioned though she would redirect help seekers to suicidal prevention hotline, she would not stop talking to them because she did not feel comfortable that way. Another interviewee thought that 7 Cups rule would greatly hurt the help seeker and thus refused to follow the rule despite him being aware of the rule. He then cited his own experience with a suicidal help seeker and mentioned that his strategy of keeping talking to the person was working because the help seeker came back to him for another session a couple of days later. The potential concern is that even though this self-made strategy worked for this particular help seeker, it is not guaranteeing that it would work with another, but the peer counselor seems to be pretty convinced about that. As for volunteer counselors' self-protection, we found that little attention was paid to that aspect, as most of the training was centered around counseling skills to help others. Volunteer counselors might experience negative consequences before they were even aware of that. Burnout is a major issue experienced by many interviewees. As participant number 2 described, she was not able to set up time boundary in her sessions and would let them affect her own life. And she only learned how to cope with burnout after suffering from it a lot of times. Another potential challenge is that volunteer counselors might have their own emotion triggers. Similarly, they were not aware of this threat until they encountered it in a real conversation. They learned to deal with it only after the damage was made. As a final note, our sample might be biased towards interviewees who are more experienced, and those who are unable to come up with these strategies might already drop out. This is it for the short presentation. If you want to find more about our work, especially the implications and design recommendations, feel free to check out our paper. Thank you for listening.